Hello everyone, welcome back. We're going to be looking at the appendage bones now. And so the first appendage bone that we're going to look at is this bone here. This is called the humerus. So right here, this bone, H-U-M-E-R-U-S, humerus. The humerus has a head right here. It's this rounded portion. So right there is the head. And that is what articulates with the glenoid cavity, again, of the scapula right there. You have that articulation. The humerus also has some special structures where muscles will bind and where other bones articulate. So if you look right here and right here, we have structures known as tubercles. So we have a greater and a lesser tubercle. This large structure here is the greater tubercle. I'm just putting GT because you see it right there. You can write the word. It's this larger bump. You can see this bump is much bigger here than this tiny bump over here. So this littler bump is the lesser tubercle. This is where a lot of our muscles will bind. We have ligaments that attach and bind muscles there, okay? So muscles bind at these bumps. Then if we go to the distal region, so that's on the proximal region of the humerus. The distal region of the humerus, then down here, we have a structure known as the capitulum. So the capitulum is a large bump right here. You can see the capitulum right there. The capitulum is on the lateral side of the humerus. How do I know lateral from medial on the humerus? Look for the head. The head is always going to point medial. So if that's the head, then this has to be the lateral side of the humerus. This is the medial, which means this is the medial, so this is lateral, okay? The head always points medially, so this is the lateral, and lateral is capitulum, okay? The medial bump, this larger bump, if you look at this whole structure there, this is the trochlea. It's right here. It's this beautiful notch right there, or it's this beautiful structure. I won't say notch, it's a beautiful structure there. So this is the trochlea. The capitulum articulates with this bone known as the radius. The trochlea articulates with this bone known as the ulna. So we have the ulna there and the radius here. And so the bones kind of sit together like this, okay? So capitulum, trochlea. And then if I flip right here, I have this region called the olecranon fossa. So olecranon is elbow, right? The olecranon fossa is where the olecranon, the elbow, sits. So again, this is the ulna, and this top part here is the olecranon of the ulna, and it sits right there in that olecranon fossa. You can see the spelling right here, olecranon fossa right there, and it's right here, okay, olecranon fossa. And I already pointed out the head, which is the last structure, which is right there, okay? So this is trochlea. This is capitulum. This is ulna and fossa. Head. Greater tubercle, which I wrote, and lesser tubercle. Perfect. Okay. So I'm going to go to the next slide. So now we have our two lower arm bones. So we have this first bone, which has a flat top right there. This is the radius. Really, the only thing you have to know is the radius, and you have to know that this is the head, so the top of the radius. This is the most proximal end. This is the distal end. And know that the radius is lateral. It's by your thumb. It's a lateral bone. This then is the ulna. The ulna, a lot of people make mistake in these. How I remember is the ulna has this notch, and if you turn the notch this way, right there, you can kind of see a U for ulna. The radius doesn't have that. So that's how I identify the ulna from the radius, okay? So the ulna has specific regions that you have to know. So the first is this upper point right here that articulates with the trochlea. That is called the ulna process. So I'm going to just put right here, ulna process, okay? And it's right there, the spelling. Then we have this notch. The ulna articulates at the trochlea of the humerus. So this notch is known as the trochlear notch. So this structure here is the trochlear notch. And here's the spelling right there for trochlear notch. The last structure is then this pointy structure out here that makes the end of that trochlear notch. You have the ulna process up here. We have the coronoid process right here. So right there, coronoid process, okay? And you can see the spelling right there. So again, between these two bones is, and I'm just holding them like this, between these two is a joint. There is a structural joint composed of some type of connective tissue. I'm not going to give it away. I did it on the upper one, but I'm going to have you look. In chapter 9, you should find what the joint is called, okay? So it's both structurally, what is it composed of, and functionally, how does it move, okay? And then the name of that joint you should find as well, okay? So the next bone, biggest bone of the body, is the femur. So this is the femur. This is your hip bone. The femur, you know what I don't? Oh, I do. I have head. I was going to say, has a very large, prominent head with a neck on it. The head of the femur articulates with the acetabellum of this coxal bone. The acetabellum is actually composed of all three bones. So this top part of the acetabellum is the ilium. Over here we have the ischium, and on this side we have the pubis. So all three of the coxal bones make up this acetabellum. And we have this articulation where the bone can just move inside. It's a very deep joint, okay? So we have this head right here. Then we have these large prominent bumps. Do you see this large bump right here? And there's a tinier bump there. This large bump is known as the greater trochanter. And this tiny bump here is known as the lesser trochanter. So they're right there, the words. the greater trochanter right there and lesser trochanter, you have to feel for these bumps to figure out where you can give certain injections. So in nursing school, you learn these markings for good injection sites into your hip. And I show them to you now so that you know them before you go into nursing school. The other two regions are the medial and lateral condyle. So again, this is the femur, and at the bottom we have a medial condyle here and a lateral condyle here. How do you know the difference between medial and lateral? Again, you're going to look for the head. So here's the head. So if I go straight down, the head is always pointing medially, goes into the body. So this is the medial condyle. Laterally is going to be where that big greater trochanter is. And we go here, and there's that lateral condyle. So on here, we have medial condyle, MC, and here we have lateral condyle. And again, you can see the spelling right up there, okay? The next bone is a weight-bearing bone of the lower leg. This is known as your tibia. So it has a very large flat top here. So that's the head of the tibia. If you look, that's where the femur articulates with the tibia. So just like that. Between this, there is cartilage. Of course, we have cartilage between every joint, or movable joint, I should say, to protect. But the tibia is a fully weight-bearing bone. It holds the weight of the femur, right? And so of the body. So the parts that you need to know on the tibia are the tibial tuberosity. So up here's the head, just so you know. I didn't say that, but I want you to know that that's where the femur articulates. You need to know the tibial tuberosity. So right here, and you can see it on here. You see that bump right there? That bump is the tibial tuberosity, okay? Tibial tuberosity. You see the spelling right there. This is important for EMTs, medics, when they can't get into a blood vessel and they're trying to put in an IV in a very, serious situation. They will use a special tool to pop this area out, and then they can go right into the blood vessel in the tibia. Apparently, if you're in a serious situation where they have to do this, you're probably not going to feel it. So how do I know this stuff? I learn it from from EMTs that have done it. So that's why I make you learn that. And then right here, this is known as the medial malleolus. Right there's the spelling for medial malleolus. You can see it right here. It's at the most distal region of the foot, or of the leg, right before the foot. And what's interesting about that is, so that's the medial malleolus. It is, if you look here, there's your foot. It's your medial ankle bone. So if you've ever felt, and you all have felt your ankles, your ankle is part of the tibia. It's that medial malleolus. Okay. And why is it medial, you might ask? The tibia is the medial bone. This is actually the wrong side, but that's okay. Hold on. I'm going to grab the right femur. It says they don't match. I have a bunch of disarticulated skeletons. So the tibia is the medial bone. And so when you have the tibia, you have, it's going to be on the same side as the head. So like this. And then this bone here is, sorry, like this, is going to be lateral. And this is your fibula. So we have the tibia, which is medial. The fibula, which is not a weight-bearing bone, is lateral. This is a very, very wide fibula. It's kind of bent, but that's okay. You get the idea. It is a lateral bone. Actually, it's the next bone that you have to know. So here we have the fibula, and the only part of the fibula we really care about is this flattened portion here, known as the lateral malleolus. And if you're wondering what the lateral malleolus is, it's right there. It is the region of the bone that makes up your lateral ankle. So we have the medial malleolus on the tibia, the lateral malleolus on the fibula. Fibula is not a weight-bearing bone. It is a supportive bone, but it does not carry any weight. The tibia carries all the weight for the lower of the body on the lower leg. The next bone is this cute little bone here. This is called the patella. The patella is known as a sesamoid bone. So a sesamoid bone is a special type of bone that forms in areas where there is a lot of friction. So we are not born with patella, but these are one type of bone or one sesamoid bone that everyone develops. So in general, everybody has patella, and they're found at the knee. So this is also known as your knee or kneecap. The patella is formed in lines of stress. So as babies are moving their knees or their legs in and out, they're causing a lot of stress, and that's when the patella forms. So when you first are born, you don't have these, but within the first 6 or 8 months, you'll start developing these patella. And actually, sesamoid bones can be found in your feet. They can be found in your hands. They can be found in any area of the body where you have a lot of stress. So hands and feet tend to be particularly common areas for these sesamoid bones to form. All right, I'm going to stop this video, and we'll get in our hands and feet in the last video. Bye.